Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. In this episode, I want to discuss semaglutides, how they're used, what they're good for, maybe some precautions that you might have not known about, and also what happens after weight loss. So, as we all know them as Ozempic, Mounjaro, Wegovy, those are the three most common ones. There are other ones that are coming out on the market. Most of the time, they are shots that are given weekly. They can also have a pill form that's coming out as well. But the semaglutide group of medications have been used for over a decade to treat type 2 diabetes. And so what they do is they basically help the body process insulin, increasing the insulin levels in somebody's body, which lowers the blood sugar. So what's been found is that some of these patients with type 2 diabetes were also losing weight. And with different doses, patients that are now on semaglutides are now losing weight. I've seen patients lose 10 to 20 pounds. I've seen patients lose 70, 80 pounds on them. So it's different for different people. It just depends on you. How they work in weight loss is that, again, they help control blood sugar. But in this case, what they do is they help slow down the stomach emptying. And what that means is the stomach stays fuller longer, so you're not as hungry. You don't eat as much. Patients tell me that they also don't have the cravings that they used to have. A lot of time, late night snacking. Some patients say that they don't have the sweet tooth or the sugar desires later on in the evening too. So all of that compounds to patients losing weight. Now, here's the key thing. They're very effective, but they need to be monitored. They're not without risk. So there's a risk of pancreatitis, which is inflammation of your pancreas. There can also be problems or inflammation of your gallbladder causing stones in your gallbladder. There can also be electrolyte imbalances. So you have to have somebody monitoring you. And so I recommend, if you're going to do this, go to your primary care or somebody that offers it, somebody who's going to be monitoring your blood draws, your weight, making sure that you're feeling okay. I have patients that are getting it from different states, and I'm not really sure how they're being controlled. What happens if those patients have an issue? Who's going to be monitoring them? So I really don't recommend it in that sense. I think that the medications are well used, they work well, but they also have to be monitored. And so when patients are getting it from across a state border or they're getting it from some pharmacy that's compounding it, we're not really sure if you're getting the right amount that you're supposed to be getting. We're not even sure if you're getting the right medication. So be careful with that. So that's a precaution that I would put out there for you. Also, if you're thinking about having a surgical procedure, and it doesn't matter what type of surgical procedure, remember, because your stomach slows down, it doesn't empty as well. That means that there's still food and fluid in the stomach. And when you go to sleep, either at night when you're sleeping, but when you go to surgery and you're having an anesthetic, you're at a higher risk for aspirating. So some of that fluid can come back up and you can aspirate it into your lungs. So it is now a policy that for hospitals and surgery centers, that patients using a semaglutide need to be off of that for at least 1 to 2 weeks. So I would tell you and warn you about that as well. It's just most of the surgeries that are done in this country are done electively. So you want to, again, decrease your risk. So that's something to think about. Patients that are losing weight, now they're starting to see excess skin and some of the issues that we've seen in the past with any type of weight loss, whether it's done through diet and exercise, through surgery, now the same thing. So things change. Your skin can change. You start losing volume in your face. You start seeing some jowling, some neck laxity in your neck, excess skin. Same thing, excess skin in your arms, your legs, your thighs. Now, there's no way to know how somebody's going to lose weight. So some people will lose it mostly in their belly, some in their legs. It differs for different people. You can't treat certain ways that we carry fat. So those now become an issue for you. The other thing is that as you start to lose weight, what I really recommend is that as long as you're on that medication, you're not going to be that hungry, but you may not be on that medication for long. Most programs are 3 to 6 months. And so when you come off of that, if you haven't learned to eat better and to learn how to choose your food wisely or sort of incorporate an exercise into your daily routine, there's a good chance you're going to gain that weight back. We've seen it for decades now with weight loss surgeries of various natures. Patients tend to gain that weight back because they're not changing their lifestyle. So again, I urge you to use semaglutides as a tool to get your weight under control, but after that, maintenance is really on you, and it really takes some simple habits of really just being more sensible in what we eat, portions, what are we putting in our body. So that's not going to change just because you're taking a semaglutide. So just another precaution. The other thing is I've had patients that come in that look wonderful on it. I've also had patients come in that really look almost emaciated. So remember, just because you're not hungry and you're not eating, you still have to supply your body with nutrients. So you have to think about protein intake. Even carbohydrates and fats are important in some degree. So if you're just not eating, your body goes into a starvation mode. And so you can lose lean body mass, which is your muscle mass. You can start breaking that down because your body needs protein for its everyday maintenance plus healing after surgery. You need protein. So you still have to eat right on these drugs. Just because you're not eating and losing weight, that is good on one hand, but it can also be unhealthy. Just because you're losing weight doesn't mean that you're healthy. So I would urge you to have somebody watching that. So a lot of programs and centers that are supplying this drug or these types of drugs are also having patients see somebody for nutritional discussions, trainers, any way to help you kind of get back into a healthy lifestyle, using that drug as sort of the stepping stone into that. So they work well. There are early reports out that they can even help with heart disease. There are cardiovascular issues that seem to be improved. There's a study out now that they're starting to see a little bit of improvement in patients with early onset or early forms or signs of dementia. So there's a lot of good things that can happen with this medication or this group of medications. But again, it has to be monitored. You have to have somebody who is really watching over you, because just like everything else in life, what seems to be really good in the wrong hands or not being done properly can end up in a disaster situation. So
if you're considering an aesthetic procedure, is there a certain amount of time you should wait and once you've lost the weight, or at some point should they be seeing you to talk about if they have a lot of excess skin?
I think when you get to a point where your weight loss is stable. So if you're continuing to lose weight, then probably not the right time to talk about what can be done. But if you start to plateau and you get to your goal weight, perfect time to come in and talk about it, because then we can assess what we're looking at right then and say, you have excess skin here, you still have a little bit of fatty tissue that's sort of isolated here, and we can talk about it. If you're still going to lose 20, 30 pounds, or if that's your goal, then seeing you now you can't really extrapolate all the time that this is what you're going to need down the line.
What about the term Ozempic face?
Patients then become looking gaunt because you'll lose volume in your face, just like everywhere else. So you can have more sunken look around your eyes, around the cheeks here. So you kind of get that sunken look. So using it as a tool is very helpful. But again, on those patients, they're probably, again, not taking in enough nutrients on the other side to keep up with a more healthy lifestyle. So if for those patients, protein again is probably one of the biggest things that you're missing in your diet.
And is there anything a patient can do for that?
You can. So if you've already had that and you've got your nutrition back into order, then you can do mostly dermal fillers are good to restore volume. Sometimes, patients that lose enough weight and they have excess skin, then now you're looking at neck lifts and some surgical corrections. But for the meantime, what we usually start patients out on are dermal fillers. and even some fat grafting, and that can help too. The problem with fat grafting, because patients will ask about it, because they don't want to use a dermal filler because in a year or two it's gone. So with fat grafting, as you're losing weight, that fat is also going to diminish. So fat grafting and weight loss sometimes isn't a good pick. All right. Well, I hope this answered some of the more basic questions and kind of gave everybody, how these medications work, what they're used for, and also some precautionaries so that if you're on them or thinking about being on them, hopefully this will help you choose the right place to be. Thank you again for tuning in, and we'll see you at the next Bellissimo Live.